Breastfeeding is good for both infants and mothers. Breast milk is the best source of nutrition for most infants. Breast milk changes its composition as an infant grows. So breast best meets infants' needs. Breast milk can protect kids from certain diseases. Infants who are breastfed have a lower risk of asthma, obesity, type 1 diabetes, severe lower respiratory disease, acute otitis media, ear infections, sudden infant death syndrome, SIDS, gastrointestinal infections, diarrhea, vomiting, and several other diseases. Globally, only 38% of infants are exclusively breastfed. Breast milk provides the best nutrition for most infants, including premature and sick newborns. Only in very rare and specific cases breastfeeding is not recommended, such as galactesemia and some specific conditions. Only a few medications are contraindicated, not recommended, while breastfeeding. Although many medications do pass into breast milk, most have little or no effect on milk supply or on an infant's well-being. The U.S. dietary guidelines recommend exclusively breastfeed for about first 6 months. And after 6 months, continuing breastfeeding, while introducing appropriate complementary foods, until your child is 12 months old or older. World Health Organization also recommends exclusive breastfeeding first 6 months, and then, continued breastfeeding, along with introducing appropriate complementary foods for up to 2 years of age or longer. Mothers should be encouraged to breastfeed their children for at least 1 year. The longer an infant is breastfed, the greater the protection from certain illnesses and long-term diseases. Breastfeeding and vaccination. Parents who are breastfeeding should be encouraged to breastfeed children aged 2 years or younger before, during, and after their child's vaccination. Several aspects of breastfeeding are thought to decrease pain by multiple mechanisms: being held by the parent, feeling skin-to-skin contact, suckling, being distracted, and ingesting breast milk. Infant formula is an industrially produced substitute for infant consumption. Infant formula attempts to mimic the nutritional composition of breast milk as closely as possible, and is based on cow's milk or soy milk. But composition is still different, and according to researchers, human breast milk is best food for infant.